In this video, I'm going to show you the most common questions that are asked in care home interviews and help you plan great answers. So let's look at how you actually pass a care home interview and get a job there. So the most important thing is you want to know the questions to expect. So instead of going in your interview and everything being a surprise, actually know what they're likely to ask. And then let's have some prepared and practiced answers ready to go. So when you go into your interview, you'll already have answers to the most common questions. And by the end of this video, that is exactly what you will have. Then make sure you bring all the documents that they ask for. Sometimes I've heard of interviews being cancelled because people have forgotten the documents that were asked for. So make sure you look at any communication you've got from the care home and that you bring the documents that they require. Make sure you adopt formal dress because if you don't, you won't be taken as seriously. And then lastly, a great tip to help your chance of getting the job is try and arrange to either visit or speak to the care home informally, ask some questions about how it runs, what they're looking for, and that will give you a great insight and help you prepare for your interview. And hopefully you'll start the interview having made a good impression and show that you're really serious about the job. So let's look at the questions. So one common question is, what would you do if the family complained or were angry about a resident's care? And you're going to be interacting a lot with family members who are visiting, and sometimes they will say things that are very negative. They may even make a complaint. And it could be that you are the person that receives that complaint. So what are you going to do and how are you going to answer this question? So the first thing you say is you're going to stop and listen. Because when someone is making a complaint or raising concerns about someone's care, it is very important that those are listened to. And that's the first thing that you do. You also show compassion. You show that you genuinely care about ensuring that residents get very good care. And that's the next thing you say, that you're understanding, that you are listening carefully to them, you're understanding what they're saying, and you're taking them seriously. You then say very clearly that I take all complaints very seriously. If someone starts to complain about residents' care, you don't just shut them down or ignore them or just say, yes, 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 we'll sort it out and then just wander off. You actually take that complaint very seriously and you would record that appropriately. You then say, I would follow the care home's complaints policy. So you don't just make up your own thing and say that I would do this and I would do this and I would do this. That might not be the right thing to do. So just say in very general terms that you would follow the complaints policy. Then you say you would ensure that the resident is safeguarded and just keep it very general. That basically means if the family are raising something that suggests that they are at risk of harm and they're potentially even in danger, then you have to do the correct thing and follow the safeguarding policies to ensure that those residents are kept safe. And then lastly, to round off your answer, you'd say that you'd report the issue to management in line with policy. So you keep going back to the policy and you're saying always that you're going to follow the correct policies and follow your training. So go through this list and you'll have a simple, easy, and confident answer to this question. The next question is very common nowadays because it's a very big part of care in care homes, and they often ask questions around what do you know about dementia? So let's look at a really strong answer to this. So a simple thing you can do for a definition is just remember one short sentence. So it's a progressive brain disorder that affects memory, thinking, and behavior that reduces a person's ability to care for themselves. The important points here is progressive. So someone who comes in with dementia, it's likely that that is going to get worse and worse and worse as time progresses. At the minute, at the time of recording this video, unfortunately, dementia tends to be terminal. So that's going to be a life-limiting illness for the person there. And over time, they're progressively losing their ability to care for themselves and their care needs are always increasing. One thing you want to make sure you're aware of is that dementia is not just one disease, and dementia and Alzheimer's are not exactly the same thing. Alzheimer's is one form of dementia, but there are lots and lots of other forms. It's a very complex disease. The next thing you say to really answer the question is that dementia is where residents lose the ability to care for themselves. It gets worse over time, and it can be very emotionally challenging for the family. They've got someone that they know very well, that they have a long-term relationship with, and that person is forgetting who they are, and they're ceasing to really be themselves. And that can be very, very challenging for families. And then lastly, you say that people with dementia need to be treated with respect, patience, and compassion. So people with dementia can sometimes be very difficult. They can present very challenging behaviors in some cases, and you have to be very patient with them. And that is a really important part of their care. So emphasize that they're always treated with respect, that you're going to be patient, and that you're going to show compassion for those residents under your care. And if you go through all the things on this slide, feel free to take notes, memorize some things, and you'll have a really strong answer to this question. The next one is, why do you want a job in a care home? And I can't tell you exactly why you personally would be great in a care home and why you want to work there. But what I can do is give you lots and lots of suggestions of good things that you could say in an interview. And then I would take maybe 5 or 6 of these, make a list, remember them, and then you'll be ready to go with, I want to work in a care home because of this, 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 this. You have a big list of lots of things to talk about, and you give a big, strong, confident answer. So the first thing that you could say is that you want a job where you're involved in improving the quality of life of older people. So if you do your job very well, you're going to make a big difference to people's lives. You're going to make people happier and increase their welfare. That you want a job where you're going to contribute to society. You don't want a job where you're just moving money around. You want a job that actually has some societal benefits, that you love to help people, that you are a very caring person, because that's a really important thing about working in a care home. They want people that genuinely care, that you love working with older people and say that passionately, that you want an active job. Working in a care home is a busy, active, strenuous job. And if you want that, you're looking for that active job, then this is a good time to say it. That you've had maybe positive healthcare experience. You've worked maybe in a hospital, you've worked in another care setting or another care home, and you've really liked that. You've had a very positive experience. You could talk about that, right? You may have family members who have been in care and they had very good experiences. They were well cared for, and that made you look on the care sector very positively. That you enjoy meeting new people. Residents are going to continually change over time, and you look forward to meeting lots and lots of different people and forming relationships professionally. That you enjoy working as part of a team. That maybe you've got experience volunteering in something to do with care. Any relevant qualifications that you have, definitely mention those. Show that one of the reasons you want to work in a care home is because you have knowledge and qualifications and experience that match this job, making you good at it. A nice phrase you can use if you're genuinely interested in the care of old people is you can say that you've got an academic interest in geriatrics. That's the branch of medicine concerned with the care of older people. And then you can say also that it's a very emotionally rewarding job, and that's something that might attract you to it. So list 5 or 6 of these, or even more, whatever ones you feel are a match for you personally, and then string that together and you'll have a nice, strong and confident answer ready to go. This question comes up very, very frequently, so having a good answer is really helpful. The next one is, what can you tell me about safeguarding? Some places have policies that mean they must ask questions about resident safeguarding. It's a rule, and they will not hire anyone without asking that. And if you answer it badly, it can harm your chance of getting the job. And I can't tell you what specific safeguarding question they'll ask, but we can look at about how you deal with these in general. So first thing to know is that safeguarding is all about protecting residents from harm, abuse, and neglect. That's the point of safeguarding, making sure that all of the residents there and all of the staff and everybody there is safe at all times. It is a shared responsibility of all staff. Bad answers to safeguarding questions start with, it's someone else's problem, and I would do nothing at all. I'll just tell someone and then completely forget about it and do nothing. That's not how safeguarding is supposed to work. There is clear policies that you have to follow, and it's a responsibility of everyone to be involved in safeguarding. So don't ever say anything about somebody else will take care of it. That's not entirely how it works. It's a shared responsibility. The next thing you make clear is that I must be familiar with the care home safeguarding policies, and that will set out who is in charge of safeguarding, what your role is within safeguarding, what you need to do and what you need to not do. The next thing is you make clear that we work with vulnerable people in care homes. People are by definition vulnerable in that they have lost the ability to fully care for themselves, and so we must be very vigilant. So when working in a care home, you need to be vigilant to safeguarding. It's a very important part of everyone's role. And then you say all safeguarding concerns must be reported and recorded promptly. They are a very high priority. If you're given a prioritization task, where you've got to decide what you would do first, what you would do last. Safeguarding concerns are going to go very, very, very high, usually at the very top of the priorities list. So this is how you deal with safeguarding questions. Make sure you take them very seriously and you keep going back to following the correct policies, and you emphasize that it's a shared responsibility of all staff, and you'll have a strong answer. The next one touches on safeguarding, but is a more specific situation, is how would you deal with an abusive or aggressive resident? And this is something that you could be faced with, and you need to know a correct way to answer it. So the first thing is you would want to have some sort of planning ahead. So the care home should have plans in place for residents that have in the past experienced abusive or aggressive behavior. They've displayed those behaviors. And so there are plans in place to ensure that there is safe working with those particular individuals, that you know what triggers them, you know what upsets them, and you know, for example, that you wouldn't carry out lone working. For example, if you were going into their room and they had a strong history of being aggressive and abusive, it may be that that particular person is always double staffed, or there may be some plans to ensure that all staff and residents are kept safe. You don't want to make them more angry. So if someone is being abusive and you shout at them and try and have an argument with them, that is probably not going to make them less abusive and less aggressive. The important thing is to stay calm. So when you have someone who is abusive, aggressive, a bit wound up, upset, if you remain calm, then you're not making it worse. And hopefully when they're upset meets your calm composure, it's going to be very calming and help bring the situation back down. You're going to carefully assess the situation to decide your next steps. You would seek support if appropriate. You would de-escalate the situation. So it's all about calming down, not doing things that make things worse, not doing things that cause any harm. You're trying to get everything to calm down. Remove from the public areas if possible. So that aggressive resident, you may want to move away from other residents if safe and appropriate to do so. A good phrase to use is that I would always follow my training in all situations, and that safety comes first. That my job is to ensure that that resident who's being abusive and aggressive, the staff and all other residents are kept safe at all times. So you're keeping it very general, being very calm and very confident in your answer to this question. If you have previous experience of dealing with this, say that you've had previous experience dealing with very challenging people in a care setting and that you're confident in your ability to deal with it. You don't have to give very specific examples and you don't want to reveal any private or confidential information. But if you've got experience, just mention that you have dealt with situations like this successfully and you are confident in your ability to do so. So talk through that list and you'll have a nice, confident answer. They're going to be interested in what times you can work at the care home. So they'll say, what shifts can you work at the care home? And you've got to recognize that working in a care home is not a simple 9 to 5 job, and they want to see some sort of appreciation of that. Of course, you can't commit to working times that you're not available for, and you have to stick to what you're actually able to do, but you want to offer as much as you can. So, first thing you mention is the need for continuous care. So you understand that care homes operate usually 24 hours a day. So they'll run 24/7. So every hour of the day there's care needs, and the care needs are 7 days a week, including Christmas Day. Many care homes will just never ever close. And that you're trying in this question to show that you meet the needs of the care home. So you're always thinking about offering as much as possible. And the best answers are things like, I'm very flexible and would be open to working a variety of shifts to best serve your residents. So you're not committing to very specific times, and you're not saying, I can't do this time, can't do this time, can't do this time. You're keeping it very open and very general, and you're happy to be as flexible as possible. So I'm open to a variety of morning, afternoon, evening, and night shifts. So if you've got really great availability and you're happy with all of those, just list all of them. You could say if you're slightly more restricted, but they have actually told you what the hours are on the advertisement for the job, you could say the hours you've advertised are a perfect match for me. So you're basically saying I can do exactly what you're looking for. You could say I'm often available at short notice if needed. I always do my best to help out when needed, and I do my best to be flexible to support a stable service. And you could say, if you're slightly more restricted, my preference would be talk about what your favorite working hours are or what your ideal would look like, rather than saying, I don't want to work this time, this day, these hours, and listing all the times you don't want to work, because that's very negative. Talk about in terms of preference. So say, my preference would be these times and offer as much as possible. And then you may want to just put at the end, however, I'm happy to discuss your exact needs and see how I can best support you with this. So you're trying to offer as much as you can, talking about preferences and not just giving them a big list of all the times you hate or don't want, because that's going to be very negative and can, of course, reduce your chance of getting the job. So focus on the best answers here, focus on showing as much availability as possible, and talk about preferences rather than listing, I don't want to do this, and you're going to have the strongest possible answer. Another simple recall question that they sometimes ask is, what are the 6 C's of nursing? So they are care, compassion, competence, communication, courage, commitment, and those are the 6 C's of nursing. If you're struggling to memorize those, the Caremaker song is a really great song to listen to. Listen to it a few times and you'll have those memorized. So it's a good idea just to have those memorized. And also, when you're asked about any sort of general question about good care or how do you provide good care, you can just say, I follow the 6 C's of nursing, which are, and just talk about each of these. So you can drop these into lots of different questions in your interview, and that's a really great way to structure some answers. They often ask, can you work antisocial hours? Or they will ask, can you do night shifts? Or can you work early in the morning? Or can you work late in the evening? If they ask about a specific time, they are looking for the answer yes. So if they are asking a question like this, they expect you to say yes. Of course, you may decide that you can't, that this is a hard no, that you will not work antisocial hours. That's absolutely fine. If you decide to say that, you have to give that answer. But for this particular role, if you can't work evenings, weekends, or overnight ever, then that may actually harm your chance of getting the job. And because they've asked this specifically in the interview, they're really probably looking for that. They wouldn't have put this question on the list if they weren't particularly interested in those times. If you can work those times, say yes. And if you've worked those times before, some examples or talking about experience when you've done that before really does help strengthen your answer. So that's how you deal with that one. They will ask, can you tell me about your previous experience? What they want is someone with the right experience that matches the person's specifications. So look at, if you've got the job advert, look at what they're actually looking for and try and tick all that off. And really, they're trying to be confident that you can do the job. So if you're confident you've got the right experience, show that confidence. Tell them right up front that I have got the experience that you're looking for, and explain why it is and show that you're really confident that you can do the job. So start with your care home or healthcare experience. So anytime you've worked in a care home, in a hospital, in a hospice, any sort of care environment, that's going to be your best experience. Then after you've talked about that, talk about your other work experience, but talk a lot about your care experience and then just mention a little bit your other work experience. Talk about any qualifications you have in care and emphasize the experience that you've got and where you've used those qualifications. A nice phrase to use if you're really confident in your experience is to say, I'm a safe pair of hands. I've done this before. I've got lots of years experience. You can trust me to come in and just get on with the job. And then any experience that you talk about, always link it back to the care home. So say, I worked in the hospital and I did these things. In the care home, this is exactly the same thing as I would be doing. I can do all these tasks confidently. So it's all about just talking them through your previous experience and showing them that you can do the job and that you've got the right experience, and you'll have a great answer to this question. Before we finish, they will ask something around, do you have any questions for us, or would you like to ask us anything? And the right answer is yes. So let's have some suggestions for questions you might want to ask at the end. So you'd say, what CPD does your home offer to your staff that I would be able to take part in? Can you tell me more about the training and induction process at your care home? Can you tell me about your service improvement priorities and how I could potentially contribute in my role? So all of these questions are showing that you really care about being good at your job. You might want to say, I'm very interested in this role, and I'm therefore interested to know what the next steps in your hiring process are. Find out when you're going to find out if you get the job, if there's other interviews, or if this is the final step. Then offer sincere thanks to the interviewers and end positively. Don't ask about salary right now. Don't ask about moving to another care home, taking holidays, or delaying your start date. These things can basically ruin the whole interview, so avoid any of those. I hope this interview question video was helpful to you and you'll feel better prepared for your care home interview. If it was, please like and subscribe below. And finally, thank you very much for watching.